the company. Today we are presenting telemedicine and an ultimate telemedicine gateway, we believe so, which not only provides the video link between the patient, foreign practitioner, and it also collects the medical information which are critical for a patient care and a proper diagnosis and treatment. The gateway, which is the unit itself, suitable for healthcare facility, hospitals, GP clinics, and community centers. X number of patients can be added to the device. The information is kept into the device with a memory card, can be transferred to another computer, and also sends the information to the cloud after collecting the information from the patient by itself, no intervention by patient. The device does that automatically. In the management area, as I mentioned, X number of patients can be added, and a set password can also be put into the device to make sure about security, and alarm time for medication, for meal time, or for insulin. For example, diabetic patient requiring insulin can be put into the device for each individual, and then it rings you and gives you a voice prompt that you've got the medication to be taken, or you've got your insulin, your meal time. After patient is added, for the sake of presentation, we added Rose today, and we log in as a Rose. In this panel, which is select user, the user can use, and if a password is set, then the device asks for the password by patient. Today we're using Rose. In the measurement panel, based on patient's medical condition, or if that's a clinic at home, patient preference or household preference, you can add X number of medical devices into this gateway, including blood pressure. In terms of blood pressure, is a built-in blood pressure device from Japan, A&D, then thermometer, then glucometer or lipid meter, oximeter, ECG machine, spirometer, stethoscope, and we just added pathology unit for hemoglobin and other readings. And then patient chooses which reading he or she needs today. For example, we choose thermometer today. And the patient and can be used for save and forward telemedicine or live telemedicine. So in fact, patient can collect all the information without connecting to the doctor or to the healthcare provider, and then all the information is transferred to the patient's portal, which can be reviewed by a practitioner. Or through Bluetooth or USB connectivity with this device. Now reading is transferred, and it gives to patient a confirmation of the transfer. Transfer complete, successful 2 readings, and also if a patient has this device, for example, with him or her, and check a number of readings during the day, as soon as the device comes in touch with the gateway, it collects all the reading. Or patient can set up in the unit in a way that only the last reading of this unit is transferred, or the whole reading, all the numbers. So patient collects all the medical information. Through the video phone, there is a video capability. Before that, I explained my chart. Patient is able to see the reading of herself or himself on a graph or on a table for X number of weeks or months in the past. For example, today we use blood pressure, last week for Rose on a graph. And these are the readings which we measure. And in terms of video phone, meet all the security guidelines by Medicare, including TLS and PKI encryption system. Doctor can ring patient, or patient can ring doctor. recording on video phone. Do you want to?
Yeah, sure.
From a practitioner point of view, it's a login detail for the video. So the list of the patient for on-call doctor, and as I said, depends on how many patient or who is the patient under the doctor and has access to the patient list. This video conferencing application is developed only for a healthcare environment. The real quality is on the screen. There is a problem with the screen here. Okay, so I see Rose. You can't see it in here. In here, patient name is Rose. I've got it on top of the window. Female, 63 years old, has rung me. Now I talk to the patient and I ask the patient to, for example, check blood pressure. When I say that has developed only for a healthcare environment, is because when a patient measure a reading, the reading would appear on the top of the screen in here. Something wrong with this monitor. And also, if I click on the link in here, I get the vital signs of the patient as some other reading. And if I click on more, it takes me to the patient's portal. So it's measuring blood pressure. Data is here 151/99, and then again in here. When I click on more, it takes me to the patient portal. Unfortunately, something wrong with this screen. All the readings on a graph for pulse rate or for blood pressure. I can see all the other results for this patient. For example, blood sugar. Them on a graph or on a table. There is a practitioner portal as well, which practitioner has access to the list of the whole list of patient, as well as other information, including medical history of the patient, or if there is a chronic disease management plan for the patient, which I show you as well. This is the practitioner portal, which can be accessed from any browser from anywhere in the world. And the patient rings the doctor rings the patient, or patient rings the doctor. In here, I see there are 5 new readings which I haven't checked. I go to the patient list. Put my patient list in here. These are registered under the on-call doctor. I can set standard for blood sugar, weight, oxygen, temperature, cholesterol, and other reading for the whole group of mine, or for each individual based on the medical condition or age or other parameters in this here. Let's choose Rose, same patient who rang me. Rose is 63 years old. This graph shows the overall blood sugar control for this patient over last week, last month, or 3 months. And the reading are based on the standard. This color coding, for example, red is the risk area, is based on the standard that practitioner entered for Rose at the time of enrollment of Rose into the system. So about quite some significant amount of reading are in the red area. So we know before meal for Rose, the sugar based on the standard hasn't been that ideal. It gives a quick overview of the patient status. For after meal reading, then again the situation is worse probably for this patient. and the good area is green color. In the section of medical interview summary gives me an overview of Rose's status, ways, what complication if she is diabetes, what medical condition, smoking, nutrition, drinking. It's a history of the patient. This is the latest reading of this patient. There is a communication box in here. When I check the Rose's reading and I want to communicate between myself and patient or a nurse practitioner and patient, I put some note in here. For example, Rose, I see you the Wednesday at 10. I hit send button. Then my message goes to that unit, and there is a message box in here which changes the color. And it says new, and there is a new message. And then here, TMA Smart Care Center has said, Rose, I see you on Wednesday at 10 a.m. So communication between the practitioner and also, if Rose has checked a reading and I haven't given her any feedback, I can come back here, see measurement status. For example, in here on this date, 25th of the 7th, there has been a mildly elevated blood pressure reading, and I haven't sent any feedback to Rose. So I click on send, and it says mildly elevated blood pressure. And then send. And then again, same message box or same color would change to green. And then Rose can get the message for her reading, for example. Another feature of the platform is having, if I have a number of patients, diabetic patient, and I want to send group messages, particularly suitable for aged care facility meeting or retirement villages. If you want to get a group for diabetes educator, for a dietitian, you can send them a text to their mobile or an email or through sending it to the same section in the device, the message box. And of course there is a patient registration that the doctor can register the patient, change the information or add a medical interview or delete a patient from the list, for example.
Can you add a note on there to the doctor?
You can add, yes, you connect the mouse and the keyboard and you can add information, but you cannot add any reading because of the possibility of having an error if you enter it by hand. Anything except medical information for reading from the devices.